Who should not get a chiropractic adjustment? This is an important question for anyone considering chiropractic care, especially after a car accident when injuries are not always obvious. While chiropractic care is safe and effective for many people, some conditions require medical clearance or modified treatment before an adjustment is performed. Individuals with severe osteoporosis, spinal tumors, active spinal infections, recent fractures, or structural instability in the neck should be evaluated carefully before any adjustment. New or worsening neurological symptoms like progressive numbness, weakness, balance problems, or changes in bowel or bladder control also need medical evaluation first. In these cases, traditional adjustments may not be appropriate, but other conservative care options may still help. At Auto Accident Chiropractic, we perform thorough exams to determine the safest approach for every patient. If you're in Pasco, Kennewick, or Yakima and a chiropractor wants to adjust you without a full exam or ignore serious symptoms, that is a red flag. Safe chiropractic care always starts with proper screening and clear communication. If you are injured in a car accident and want to know whether chiropractic care is safe for you, schedule an evaluation with our personal injury chiropractor at Auto Accident Chiropractic today.